Hello, good evening, guys. My name is Sasize Anthony, and I will be taking you through my database project that I was able to design. So, I was able to choose from the area of health management application systems. When I talk about health management application systems, it has some database systems that are applicable in that area. So, we have electronic health records management systems, we have health information exchange, hospital information systems, laboratory information management systems, pharmacy information management systems. But to my reason, I was able to choose electronic health records for the following reasons that I'm going to present to you. Yeah, my first reason was improved patient care. When I talk about improved patient care, there I will be telling you about how my project will be giving accurate, up-to-date and complete information about patients at a point of care, which can lead to better patient outcomes. And my second reason is about efficient information access. There to enable quick access to patients' records, facilitating more efficient care. And my third reason is about enhanced communication. When I talk about enhanced communication, here it will be improving communication and interaction between patients and providers, as well as among health professionals. Then, when I talk about safer prescribing, the system allows safer and reliable prescribing by reducing medication errors. My next reason is about better documentation. We promote legible, complete documentation, accurate and streamlined coding and billing. And we have next reason is about privacy and security. So when I talk about privacy and security, my project will enhance privacy and security of patients' data. In productivity and balance, here providers can improve productivity and work health balance by reducing time spent on paperwork and administration tasks. My next point is about cost reduction. Of course, here it will be reducing paperwork, improving safety, reducing duplication of testing and promoting presentation medications. Then we have clinical decision making. Here my project will support better clinical decision making by integrating patients' information from multiple sources. Then we have equity in health care. When I talk about equity in health care, it contributes to equitize in health care by improving all aspects of patients' care. So we are going to our next slide, which is here we shall be taking you through the key aspects of the application domain. So when I talk about the key aspects of application domain, first of all, the application domain of my electronic health system encompasses the healthcare industry and involves the management, storage, and retrieval of electronic health information for patients. So, my first outline was patient information management. The primary function of my project is to store, manage comprehensive patient information, including medical history, medication, treatment plans, test records. We have clinical decision support. When I talk about clinical decision support, my project may include features such as clinical decision support tools that provide healthcare providers with alerts, reminders, and evidences. Then next we have healthcare provider collaboration. My system facilitates communication, collaboration among healthcare providers by enabling secure sharing of patient information, referrals, and instructors. Then we have regulatory compliances. The system must adhere to regulatory requirements such as Health Insurance Portability and Accessibility Act. We have integration with healthcare systems. Here the system should be designed to integrate with other healthcare systems and technologies such as electronic prescribing, laboratory information systems, billing systems to improve efficiency. And then we have patient engagement. My project will include patients portal or mobile applications that allow patients access their health records. We have data analysis and reporting. We have telecommunication and remote monitoring. So let us go to our next slide that says analysis of benefits. When I talk about analysis of benefits, here I will first outline improved patient care. When I talk about improved patient care, it's one of the primary benefits of the system. It is potential to enhance patient care by improving healthcare providers with easy access to comprehensive and up-to-date patient information. The system can also support clinical decision making, reduce medical errors, and improve treatment outcomes. So, and my next reason is about enhanced efficiency. Enhanced efficiency can have cost savings, data security, and privacy. Then we have analytical and reporting, have patient engagement and satisfaction. My next slide is about an analysis of costs. When I talk about analysis of costs, of course, my first reason will be initial investment costs. This includes expenses such as software licensing, hardware acquisition, implementation and customization of costs, training for staff, and any consultation services required to set up the project here. Then we have ongoing maintenance and costs and support costs. Of course, as we are ongoing, there will be some challenges whereby you have to bring in some people on board to do the maintenance on the projects. Then we have data migration and integration costs, and we have operation costs, training, change management costs. So let us go to our next slide that says user issues such as skills adoption efforts and etc. Here we have skills and training. Healthcare professionals may lack the necessary skills and training efficiently use the project, leading to fluctuation and inefficiency. We have usability and user experience. We say complex user interface. Then we have data entry burden. Of course, it is a burden. It is tiresome. Then we have interpersonal and integration. Then we have privacy, security concerns, workflow disruption. Let's go to our next slide that says risk assessment. Risk assessment in technical, organizational, and others that apply. We have data security and privacy, of course. We have data integrity and accuracy. We have system performance and availability. We have user adoption and training. We have regulatory and legal risks. We have cyber security risks. So our next slide will be about limits of our project. Our limits will be inability to provide medical device. As a system, it can provide medical device. Of course, a device is provided by professional doctors, nurses. We have inability to provide physical examinations or tests on our patients. We have limited interaction modifications. So let me take you through the design view or logical view. So here, patients to appointment. We have one patient can have multiple appointments, and one appointment is associated with one patient. There I will be showing you to the relationship. Here is my table about the database project that I designed. We have patients and patient IDs are primary key. We have doctor, we have nurse, we have department. All you see in PK is the primary key. Here is my entity relationship diagram and its relationships, and we have I was able to design the interface of my system. This is how it looks like. Then here is how I was inputting data in my SQL. Then about for more reference, you will look for one book called Enhancing Healthcare Efficiency. The authors are Smith J. Then we have publication date was 15th April. Yeah. Then references, we have this. Then my next slide you have conclusion. Yeah. In conclusion, I was able to design the development and implementation of electronic health records database system represent a transformative milestone in healthcare